It's gonna be good, it's gonna be great, it's gonna be better, I can't wait. Making my move, live for the day, sing like a bird, fly like a plane. Come spill with me, Jenny D.
Hello, my beautiful people. It's me, Jenny D from Spill With Me, Jenny D podcast. I am so excited. I am here at Clair Health. They are sponsoring this episode. We've been partnering expert care for people who care. That's what I love about it. I am here today with Jessica. Jessica, I have been talking about menopause so much that, I'm so glad that Clair Health has brought you to me. We're discussing women's health in the month of May. So physical therapy, you work in physical therapy. And I really think that, with Clair, you're at the Clair Hospital Therapy Services. Mm-hmm. I think that we really need to talk about things with women's health. And I'm just so glad you're here today.
Yes, and I'm so excited to be here with you, Jenny. It's great. Thank you so much for having me.
Yes.
I'm really excited to be here. And I'm an occupational therapist, not a physical therapist.
Oh,
But you can be an occupational or a physical therapist in pelvic health, so I'll forgive you.
Oh, really?
And I work over at the Dunlap Outpatient Center, and I've specialize in pelvic health. And I have a strong focus in women's health, but we do also see men for pelvic health as well.
Well, how long have you been here at Clair Health?
I have been at Clair for 18 years. It'll be 18 years in July.
I thought you were only 25.
Oh, I wish. No, I've been here 18 years, and I started in pelvic health in 2019 when I took my first course. And
tell me a little bit about that first course, because did you say, oh, you know what, I think I want to specialize in pelvic health? Or there was something that you were thinking hey, women's health, we need to really talk about the pelvic area?
Yeah, so it kind of all started after I had my children. And that's kind of how most people get into pelvic health, is from their own personal experience. So after I had my children up on the family birth unit, I was in the shower and kind of thought, you know what, I feel so weak. And I wish I had an OT with me to kind of help me.
Right.
So I'm not going to pass out and fall in the shower because my husband had gone home, take care of the other kids and the dogs and stuff. And I thought, these people that are giving birth, this is a major change in life. This is a major trauma to the body. Mm-hmm. And there's definitely a role occupational therapists can play in helping with this role transition, helping with the physical and mental recovery. And that's kind of when I started, and I thought, there's a place for OT here. There's got to be something out there, some sort of training. And then I fell into pelvic health, learned about it, took my first course. It was up in Syracuse, New York.
Oh, wow.
It was a 3 or 4 day course back then. And it was like a live lab. So you're both the clinician and the patient.
Oh, no way.
Yeah. It was
I've
intense.
Never heard of that.
I mean, it's just a room full of tables with people lying down under sheets. And
you're kidding me.
Yeah.
Oh my gosh. See, this is stuff that I don't know anything about this. I'm just a podcaster, but
yeah.
I love that you're sharing this with us. And for for you to be thinking wait a minute, my own personal experience, this is something that we really need to get into and help women with this. Yeah, because, with telling the story about pelvic, a lot of women, for some reason, they don't want to talk about it.
Yeah.
Or they think that they're the only one.
Right. It's a kind of a taboo topic. It's not something you bring up in standard conversation.
Right. Yeah. Hey, how you doing? My pelvic's been really weak lately.
Right. So that's kind of what makes it appealing to me, is you really get to know people well.
You do.
You kind of get this really close relationship with people, and they're telling you things they probably never told anybody before, or only their close friends. And then you can really help them with those areas that are bothering them.
Right, because sometimes, some people, and we'll get into this, you can't even leave the house because you're so afraid that you might have an accident. But do you collaborate with any other medical professionals as part of your patient care plan?
Yeah, absolutely. Collaborative care is one of the pillars of trauma-informed therapy. So being trauma-informed means that you have an understanding of kind kind of how other professionals can help. So it's a team approach. It's not just like, I am going to fix you.
Yes,
I'm going to get you the best care.
Right.
I'm going to show you other areas of your care that, other professionals that could help you, whether it be counseling or sexual health, physical therapy, colorectal surgery, urology, gynecology, urogynecology, just kind of like pulling all the people in to help, because it's not usually a one-stop fix, but sometimes it is.
That's so true. I didn't even think about that, because you need education on this, because we think pelvic, we just think women, one area, that's it.
Right.
But now you're introducing it to me as it could be anywhere down, below in your bowels, and men and women, right?
Men and women, yeah. And it's all kind of interconnected. So what I really like about it is it's kind of a holistic approach. So instead of just focusing on just the pelvic and just the pelvic floor, we kind of look at the whole thing. We look at, what your roles and routines are during your day, your habits, how well you're eating and drinking, how you're moving, what kind of things you're doing that are making your symptoms worse, what things you can do to make your symptoms better, how you can integrate the exercise into your daily life so it's not something else you have to do.
Right, so true. And I feel like I've just pelvic therapy is, I don't know, I just feel like I just heard of it 5 years ago.
Right, and that's what most people say. Has it
been around for a while?
It's been around for quite a while.
Really?
Yeah, and it's only really just recently with, the kind of explosion of social media and
that's true.
That kind of stuff just kind of come to the limelight, but it's been around for a long time.
I think that's the thing, the definition of it, a lot of women, men don't really know what it means, because I'm like, oh, but my doctor said this to me. This was a couple of years ago, because I told her, I said, I feel like I have to go to the bathroom all the time. Mm-hmm. And she's like, well, you need to get into the, you need to go talk to a specialist about the pelvic. And I was like, no, I'm not doing that. Yeah. So Jessica, tell us a little bit about, you're probably going to see a lot of patients that do say that. What do you say to them?
I mean, sometimes it takes people years to get up the courage to come, but what I would say is the sooner the better, because it's knowledge you can use for the rest of your life, and it is about quality of life.
So true.
I mean, it's about not having to run to the bathroom every 5 minutes. It's about not being afraid to go places where there's not a bathroom.
Road trips, when you're on vacation.
The fear
as soon as
of
I
having
drink water,
stop.
I'm like, I got to go. And they're like, come on. And then I become dehydrated because I'm afraid to drink anything, because I'm like, I don't want to have to stop.
Yeah.
I just didn't. Yeah. I just thought, wow, I'm getting older. It just comes with old age. I think that's, the myth of what we feel.
That's totally a fallacy. Yeah, it's not normal to have leakage. It's not normal to have sexual health dysfunction related to age. It's all kind of has to do with strength, with quality of tissues, and just knowledge about how to use that area, how to keep blood flow going, and all those things.
We're all so different. Our symptoms, you might tell me one thing, and I might tell you hey, with my symptoms are different from yours, but a lot of women I talk to that are around my age, we do talk about how it just feels like, that feeling of you have to, pee all the time. And I'm just like, oh my gosh, I thought I was the only one.
Yeah. You're not the only one.
That's why
it is a very common complaint.
It is. And like you were saying, Jessica, social media blows this up. I was talking to Erin off air, and I was like, I was researching, the pelvic therapy, and Dr. Kegel.
Oh, yes.
Tell us a little bit about Dr. Kegel, Jessica.
Yeah, so from memory, so the Dr. Kegel was a man, Kegel Bagel, same difference. So is a man who studied women's health, and he came up with the first pelvic floor kind of exercises and for women after childbirth. And he kind of coined the term, although there were other people studying it at the time, and some of them were actually women that were studying these pelvic muscles and how to rehab them, especially after childbirth. But he got the name.
Yeah, right.
So the name of the exercise is now Kegel. So there you go.
I used to laugh about that when my doctor would say, "You need to do." I'm like, "Yeah, I'm not doing that."
Yeah, and that can be a myth too. So one of the things I like to bring awareness to is that it's not just about Kegels. So pelvic floor therapy is not about Kegels. Pelvic floor therapy is about education. It's about learning about your body specifically, because really there's no cookie cutter approach. Right. There's no one thing fixes all. And Kegels are not the answer. Kegels are a very isolated pelvic floor exercise. And I would tell you that most of the people that come into my room are not doing Kegels to fix their problem.
Really?
Most of the people that are coming in this day and age need relaxation. They need to lengthen and relax the muscles rather than squeezing and contracting them. Most people are already contracted, and especially if you're having jaw pain, neck pain, shoulder pain, you're already tensed up.
Yes.
And your pelvic floor kind of goes along with that tension kind of pattern. And if you're really tensed up, it's like, any other muscle in the body. If something's restricted in movement, it's not going to work well, right? So you think about like that trampoline analogy. You think about the pelvic muscles as this hammock or trampoline of muscles that kind of support our organs and are part of our core system. But if that trampoline is pulled really taut, those muscles aren't going to work right. Or if they're real sagged down, if you've got a real saggy trampoline, that's not going to work well either.
Right.
So it's about finding the just right balance in the muscles.
Oh my gosh.
And the range of motion.
You explained that so well.
Oh, I do.
I'm like, tell me more. Tell me more. So how do you create like a safe, supportive environment for women who might feel uncomfortable talking about it?
Yeah, so safety and trust are really the foundation of pelvic floor therapy. So you have to be able to create an environment that makes people feel at ease, because people aren't going to tell you what's going on with their intimate parts if they feel like you're judging them, or you're going to run and tell your friend. So it's about building kind of a therapeutic alliance, so you feel comfortable, you feel at ease, and you feel like you're just talking to a friend. And my goal is to really, really foster that relationship. And that's why I love what I do so much, because I feel like I've got so many friends now.
You're so
I'm
passionate
like
about it.
Making all these friends.
I love it.
No, but it's really getting down to like your habits, your routines, and what your life looks like with this dysfunction, and where you foresee your life going when that dysfunction is fixed.
Right.
So just building that trust and that relationship. And I really try to really explain what I do and why I do it. So I'm not really doing things to people. I'm teaching them about their body, and teaching them how to use their body and know their body better.
Like a personal trainer. Like you can't do it. You can't do it for them. They have to do the exercise.
Yeah.
To do that.
But so it's a lot like coaching. It's a lot of guidance, coaching, and teaching them, how to do these things at home on their own. Right. So they have a better follow through, and overall just kind of quality of life in the future. So if it creeps up again, like, I'm going to go back and I'm going to do X, Y, and Z, and then that's going to probably resolve the issue. Right.
And you make me feel so at ease. So I'm like, let's do some exercises now.
Sure.
Now, can you walk us through what a typical pelvic floor therapy session would look like for a new patient?
Yeah. So a new session.
I'm trying to think what it would be, because I'm sitting here in my seat.
Yeah. So we kind of, this is what it's like.
Okay.
It's just this kind of back and forth, me building connection, you kind of letting me know what your concerns are. And it's more like just sitting down.
Yeah.
Conversation. It's, we could be drinking coffee or something, although that's a bladder irritant. We could be sitting here and just having a conversation. Yeah. Yes. We talk about how pelvic health is affected by sleep, stress, trauma, our relationships with other people, and how that can impact how the pelvic floor responds. So most of the time, it's just a back and forth conversation, me kind of gathering information, the patient kind of giving me the information, and me asking lots of questions.
Right.
And sometimes there may be an examination of sort, but only if the patient's comfortable with that. And I can kind of get a feeling as I'm talking to somebody, whether they're comfortable, whether we do a external palpation where we kind of just see how the person's breathing and moving, or sometimes we'll do just an external observation of the muscles, maybe just where I'm visualizing the movement of the muscles while the patient tries to move them.
Right.
Sometimes they're palpating their own muscles so they get an idea how they feel. And if they really are really wanting to know exactly what's wrong, and they're really gung-ho and they're well educated about what to expect, I may do an internal exam of the muscles and just see where they are as far as strength, weakness, coordination, quality of tissue there, and we get a good picture of that usually, and it's usually only like 5 minutes or less.
I mean, I'm learning so much from you just from hearing from that. So like, what are the signs? Like that was my biggest thing, like the signs or symptoms that might indicate a woman could benefit from pelvic floor therapy. Like, even if it hasn't been formally diagnosed with a condition, like, sometimes when my doctor said something to me a couple of years ago, I was just like, I'm not doing that. I really didn't know anything about it. And I thought, well, is this just something that I'm going to have to do surgery? Like, I thought it was surgery.
Oh, right. Yeah. So there's lots of signs. And a lot of times these are already things that are happening to you. And this is, I think, is why sometimes it gets overlooked or, kind of
misunderstood.
Because we come to accept a lot of these things, right? So whether
especially
it be
as women,
leaking with sneezing or coughing or laughing, it's just stuff you got to live with, but it's really not. So there's no form of leaking that's normal, right? And even urinary frequency, going to the bathroom more than 6 to 8 times a day, having pain with intimacy or feeling pelvic heaviness or pain with sitting. Even constipation, which is very prevalent in our society today, based on our eating habits.
I'm like, check. I'm gonna keep going.
It is something that we can deal with in pelvic floor therapy, and it's not something you have to just live with.
Right, and I think we should start talking about it more.
I'm
open and honest with people, and I tell people, like, look, I know that my bowels have never really been, right. Like, people would be like, oh, I go every day. I'm like, well, that's, great. I'm glad. I'm happy for you. But there's been times where I'm just so uncomfortable. I'd go on vacations because do you think, and that's true, when you go away, like the stress you were talking about, that has a big part about feeling comfortable about being in a different location.
Your body's not going to relax if your sympathetic nervous system's kind of fired up.
Yes.
So that kind of stress response in the body is not going to allow the body to relax in order to have a bowel movement. No. So there's things that we can do to try to create a routine, a habit, so that even when you go away, you can do a couple little things that make your body feel safe, kind of activate that parasympathetic nervous system so that your body feels that, and then you can go to the bathroom.
Right.
But that's a very common problem. That's not unusual at all.
Right. Because that's the hardest thing is, I would always fear going away knowing that I'm like, oh my God, I'm going to be uncomfortable. The discomfort of your stomach. And, you're just miserable. And I'm like, how can, my one girlfriend, she always goes, I don't do away games. She only goes at her own house.
Well, that's
everybody has their own kind of thing that they do. So what are some common pelvic floor issues that women experience? I know we were talking about the urine. Do they experience different issues, like at different stages, how we were talking about menopause?
So there's definitely different pelvic floor challenges as you go. Like childbirth can be traumatic for the pelvic floor.
Does it matter how many children you have?
Well, it definitely influences the number of childbirths, can influence kind of the severity of the issues. But not necessarily. I mean, it sometimes can, not always. So it depends on, how well you carried during pregnancy, how much activity you did, how well you kind of managed your condition during pregnancy. Some people do real well, some people don't. But for women, as they approach menopause, as the hormones kind of fluctuate and change, that can cause vaginal dryness. There can be pain with intimacy. There can be changes in bladder health. There also can be trauma or physical, emotional, sexual trauma that can kind of show up in the pelvic floor at any age. And it doesn't always present as pain. Sometimes it's discomfort or just not being able to connect to your body the way you used to be able to.
It's true. And that is true.
That's why in pelvic floor therapy, we really try to focus on like a trauma-informed approach, meaning that we aren't going to be doing things to you without your consent. And consent is kind of a continuous ask, how do you feel? What's your goal? Is it okay if we do this? Is this something that you see yourself being able to do or participating in? So that it's not, a re-traumatization traumatization.
Right, exactly. I think that some of us want that magic pill.
Oh, everybody
right?
wants a magic
Just
pill.
Just give me that pill.
Just give me that one thing I got to do that's going to make this better, right. And I'm out of here, right?
I mean, this is getting a little intimate, but I even tried that Dulcalex or what is
that?
Oh,
sure.
Oh, and that is the most uncomfortable thing to take because your stomach pains are so bad. But I've even tried those. I mean, there's so many things on the market as far as like if you're trying to feel at ease. Do you recommend anything, or do you think that the exercise does the best? Oh, I love the light. Well, we have a disco light here. Look at this.
That's my water bottle.
It's saying you got to drink water, Jessica.
So that would kind of on cue be my first recommendation is drinking more water. That's kind of what most people aren't doing.
I'm in the bathroom now.
Yes, that's your reminder. But thinking about drinking your water and kind of spreading it out throughout the day. So staying hydrated. And sometimes that means half your weight in water in ounces, or sometimes that just means like drinking a little more than you normally would. So drinking a little when you wake up, drinking some with your coffee or your bladder irritants, and fiber. So looking at your nutrition, looking at how well you're eating, aiming for that 25 grams of fiber a day. But remembering if you're going to increase your fiber, you're going to have to make sure you increase your water. And fiber is not great for everybody. So kind of finding the just right fit. And you don't want to go from eating 5 grams of fiber to 25 grams either, because that's going to just make you feel bloated and gassy and miserable. So it's something we have to kind of gradually increase. And sometimes we work with a nutritionist to try to get those fiber levels up, or look at what's irritating the bowel, because sometimes there are bowel irritants out there, and everybody, everything else, everybody's different, and different things affect people in different ways. So it's good to make sure it's an individualized approach, whatever you do.
Right. Back to menopause. Do you think it's more common with women that are going through menopause for their pelvic floor to really like the muscles to?
Oh, sure. So with those hormonal changes, the muscles and the ligaments are going to change also, and the integrity of those tissues is also going to change. So sometimes that means an increase in feeling of heaviness in the pelvis or prolapse type feeling. Sometimes that means more urinary urgency or frequency. Sometimes that means more pain with intimacy. And those things kind of are all interrelated. So it's definitely best to talk to your gynecologist or your urologist, whoever you're seeing, about those changes and what you're feeling, and then making sure you understand what's happening. And if you feel like a pelvic floor consult is necessary, and it would help you, and most of the time it would, just learning about your body is the best way to go. Lots of times the physicians are wonderful, but they don't have time to spend with you really educating you, which is why therapy is so important, because therapists' main goal is to educate you and at least in pelvic floor therapy, have a better understanding of your body and things you can do to protect it and build it and make a better quality of life.
Oh my God. I mean, just sitting here listening to you, and here I feel so bad by saying that when my doctor told me about it, I'm like, yeah, right. I never even heard of it. But talking to a specialist like you, an occupational therapist that can help you with that, like that to me, like a lot of people probably didn't even know that was out there.
No, a lot of people don't. And that's what I love about it, is when they finally figure out what it is, they get really excited. They go tell all their friends and they're like, oh, I did this thing and it was so great. You need to do it too. And I do see a lot of that. I see a lot of people that come and then they refer their friends or their family members, because they're like, this really changed my life. And that's what's so exciting about being a pelvic floor therapist, is that on a daily basis,
what is it? What the rewarding part of it?
You get to change people's lives, which I know I was an acute care therapist for a long time, and I know I made a difference in people's lives, but I didn't always see it. But doing this type of therapy, I really see it on a daily basis, and it's really rewarding in that sense.
I can, like we were saying before, like it could change somebody's life, and why sit at home and suffer when you have someone like Jessica here at Clair Health that can help you with that? It's just like, I referred her.
Oh, okay. Yeah.
But I mean, like to me, like just hearing about that now, I'm just like, well, okay, I need to get signed up here. But for me to come to you, I would have to get a prescription from my doctor.
So a prescription from a doctor. It can be a PCP, it could be a urologist, a gynecologist, it can be a nurse practitioner or a CRNP. It can be a PA. It can be any of those things. So usually a family practitioner is usually what you see on an annual basis, or a gynecologist. They can usually make the referral.
Okay, yeah, because especially if you're listening out there, or you're viewing this and you say, you know what, my doctor have never talked to me about the pelvic floor therapy. This is something to look into, and to definitely, talk to your doctor and get here to St. Clair Health, because you got some professionals here.
Yay,
I'm sitting here like, I'm doing my exercises. So, what message would you say to women listening? Because I know we were talking about this in the beginning. It's something that maybe somebody doesn't want to talk about, but when we were talking about going through menopause, which is such a big subject for me right now, because I am in it, full in it. And that's why we were talking about how I feel like I get up like 3 times a night.
Yeah.
And it's really disrupting my sleep. It's, it's definitely going with your stress of your mental state.
Oh, yes.
So what would you tell someone, about to get them take away from our conversation?
You can get help. You are not broken. Yes. And what you're feeling is pretty common.
We're not broken.
Yeah, you are not alone. Yes. And there's support. There is definitely healing, and there's definitely hope. And providing that hope to women is what I love to do. They walk out and they feel like, yes, there is actually hope.
Yes.
I'm not doomed to be like this for the rest of my life.
I know.
And there are some just fairly simple strategies that are going to resolve a lot of your issues. And, some people come once.
I was going to ask you that. How long does it take?
I would say on average, 4 to 6 visits.
Oh, that's it?
That's it. So in a month, you could pretty much know what you need to know.
I could go on vacation.
Yeah, and not have to worry about it.
Not stay home. Oh my God, this conversation was so great, Jessica. I knew when she walked in the room, I was like, we are going to have a lot of fun, because you have made this so comfortable for me, and I can only imagine how your patients feel when you come in the room, because you're just so nice and warm and bubbly, and I just appreciate you taking the time to talk. And I would love to have you come on as a guest for Menopause Mondays. If you're ever available.
I would love to. That would be fabulous.
To learn more about the pelvic floor therapy and other women's health physical therapy services at St. Clair Health, visit stclair.org/outpatients rehab, or call 412-942-4060. Thank you so much,
Thank you so much, Jenny. It was a pleasure.
Thank you, hon. And thank you so much to St. Clair for partnering with me. Expert care for people who care. Take care.
Come spill with me. Come spill with me. Come spill.